Good afternoon. My name is Dr. Richard Maggio. I'm with Richmond Health Network Urology Department, and I'm here today to kind of make it kind of simple and silly to think about your prostate. I usually tell my patients, if you think of your prostate like a donut, and this hole right here, is where the urine goes through. As the prostate gets bigger, the hole gets smaller, and it makes it more difficult for you to urinate. So I'm going to demonstrate for you, in simple terms, what it looks like when you have an enlarged prostate, when you have a normal prostate, when you have an enlarged prostate, and what it does to the bladder. Because the big push on treating the prostate is to help the bladder. So pretend this is your bladder filled with urine. The prostate sits beneath the bladder and surrounds it. So what happens is, in somebody who has a normal sized prostate, their bladder empties to completion. However, we're going to do this again, and I'm going to lick the glaze off the donut. If the prostate gets bigger, that hole gets smaller. So when your bladder fills and you try to void again, what happens is it may start to come out very slowly. And some people, even though they think they're finished emptying, they still have urine in the bladder. What happens over time is this bladder becomes very floppy and it can't contract anymore. So there are some people who won't be able to urinate, but the symptoms may get worse and worse over time. So if you have any of the symptoms that are consistent with an enlarged prostate, waking up at night to urinate, pushing to get the urine out, feeling of urgency, the sudden need to void, sometimes losing your urine, inability to urinate, slow stream, straining, you should see your urologist, and he can help your donut.